Hello, I'm Dr. Chalabi. I have been practicing medical aesthetic for 20 years, and the name of my practice is Park Avenue Medical Spa. We are located in Armonk, New York, and thank you for joining me today as I present some treatments we offer to improve your appearance on the screen. Zoom meetings have been challenging for all of us in the last few years. I have seen many patients complaining of how they look on the screen. They notice for the first time lines and wrinkles, jowls, loose skin on the neck, or textural imperfections like pigmentation or redness. With the advancement in aesthetic medicine, there are good treatments for everyone. Just make time for a consultation with a medical professional who can guide you on your journey to address all your skin concerns and help you gain back your self-confidence. It is important to have regular facial cleanings because that keeps your pores clean of sebum, prevents breakouts. Also, it is important because it can produce a good and deep hydration, as well as having a good home skincare regimen. We carry a medical grade line. SkinCeuticals has very good products for different types of skin, addressing hydration, pigmentation, redness, lines and wrinkles. So an important part of your journey is utilizing the proper skincare regimen at home. One of the very common areas of concern is laxity of the skin of the neck, and for those who are interested in improving that, we have a treatment which we call tight sculpting, and that utilizes energies like Yandiag and erbium, and those can also be combined with PRP for better results. With this modality, we can also reduce some of the fat that's in the submental area, and for those that have more of those concerns, we will add even cool sculpting. So oftentimes we choose a combination of treatment of different type of procedures, which is why it is very important to start with a consultation. During the consultation, we discuss all of your concerns, and then we can choose which one is going to give you the best result. Other treatments which can improve your appearance are those treatments that address tightening, reduction of wrinkles, and reducing textural imperfections. For those, we do use lasers, and we have several different types of lasers that have multiple energies, like our Photona laser, which uses both erbium and Nd:YAG. We also use radio frequency. Those are being generated by our machines, the Morpheus and Fractora, and those are very effective in producing tightening, but also reducing any lines and wrinkles that you may have. We can combine the different type of modalities depending on what are the needs of each one of you, and how severe the laxity or depth of wrinkles or other imperfections like pigmentation, redness, dilated capillaries. All those can be improved with the different type of equipment that we have in our practice. Botox, Dysport, Xeomin are called neuromodulators, and they all have the same action, reducing the intensity with which we frown, raise our brow, or create those deep lines around our eyes. These treatments are ideal to reduce all your expression wrinkles with minimal or no downtime. They are safe in the hands of an expert medical professional and will require maintenance only 3 to 4 times per year. Fillers, as their name indicates, are used to fill in loss of hyaluronic acid, fat, or bone. We can use them to reshape your face, to add volume to your cheeks, lips, or even temples. They mimic naturally occurring substances in our bodies, and they help plump or hydrate and even stimulate collagen or bone formation. Fillers are slowly metabolized by our bodies over a period of 9 to 12 months. Sometimes they may last even longer. Each filler has a certain indication, which is why it is important to know what is injected in your face, that the product is FDA approved and safe to correct imperfection which bothers you. The most commonly used are Restylane, Juvederm, Belotero, and Sculptra. We also have introduced a newer type of filler called Teoxane, which is distributed by Revance. The choice of filler is determined by the area we are correcting, the amount of volume loss, and how quickly one wants to see the result. Collagen stimulators like Sculptra or PRP will take longer to produce the desired effect since they work by stimulating your cells to produce collagen. You can find information about all these fillers on our website. Platelet-rich plasma is another safe treatment to promote collagen, and it can be used alone or in combination with other aesthetic treatments. The session starts by us drawing blood, after which we create a concentrated serum. The serum contains mostly platelets, and those are the ones that are going to produce the ultimate effect, which is releasing growth factors, and those stimulate your cells to produce more collagen. Thank you for joining us today, and please stay tuned for our question and answer session. You will receive a text shortly if you would like to hear our special offers and set up a consultation. Hello everyone, and thank you for joining me today. Please let me know if you have any questions. I'll be more than happy to answer. So the first question, if I book a consultation, can I get treatment same day? I think the time that you book a consultation, it would be great if you can ask if there is time, so that we can have time for the consultation and also for your treatment. And sure, that is a possibility. The next question, do you think at-home LED face masks like Dr. Dennis Gross's help tighten skin and help reduce line and wrinkles? I do believe that you cannot truly compare the products that are sold for home use with the products that we have in office. But again, depending on the problems, depending on the severity of them, you can follow treatments that are done in the office with some home care devices. Next question, what would be the best to help with my jawline? It is sagging more and less defined. I also now have the resting sad face. I think the best in this case would be to set up a consultation so we can determine exactly what the needs are. It could be some tightening lasers, it could be a combination of treatments. So I think that would be the best way to address this. But there are definitely very good treatments today that can improve your looks. For the neck treatment, can you go over downtime and how soon I would see a result? So it all depends on what the needs are. I think depending on the amount of laxity, if there are lines, wrinkles, it also there's fat or not. Those are the type of things that determine the type of downtime. Usually in our hands, you can see some redness. The redness in worst case scenarios lasts a few days. So I would say the worst case would be about a week, but not all just redness. Redness in the beginning for the first few days, and then just maybe some dry desquamation that can continue through the week. Those are pretty much the only type of side effects that we see, and healing without any type of complications. What about bone loss by loss of teeth? Does filler help? There are fillers that do, for example, like Sculptra, that are going to help also with some periosteal or even bone production. So though that would be an ideal type of filler. Again, it depends also on age. So this again, I can answer more and give better information once I see you and I can see exactly where is the area of loss. I have developed recently what looks like a little saggy fluid filled bag under my eye. What could this be and what treatment do you recommend? I think again, it's difficult for me to determine without seeing you. So ideally would be if you have time and you're able to come in and have a consultation, and then I will be more than happy to give you my opinion and see if there's something that we can do, or it is more of a surgical option. My neck looks like I have muscles popping out when I smile. That has happened with age. Will the same treatments you outlined work for that angry neck as well? I think again, I would have to take a look and see exactly what you mean by muscles popping out. I think we have a good number of options for neck tightening. So could be lasers, could be Botox, or some other types of treatment. So again, a consultation will be the way to go. Can Botox help lift brows? Yes, absolutely. Botox can help lift brows. Again, it's important to see the expression and if in reality we can achieve a good result. You don't really want to have that very unnatural type of a look where we see that a lot, and which scares people away from Botox and other type of neuromodulators. So again, if you can make time to come and see us, I'll be more than happy to tell you if it is possible in your case. I'm embarrassed. I haven't had a facial in years. Do facial help with pigment problems? Facials cannot truly help with pigment problems. There are other treatments that will help with that. Those will be mostly lasers or intense pulse light machines. Those are the type of treatments, or even some peels, which could be really very good, can give very good results in a shorter period of times if you can deal with some downtime. What do you do for loose skin on the legs? Loose skin in any part of the body we can treat with our tight sculpting technique. I grind my teeth and it makes my jawline look larger. Could Botox fix that? Yes, Botox can be injected in the masseter muscles and that can reduce that look. What do you suggest for rosacea? Rosacea is not that easy to treat, but we do have, between the LED and our Photona laser, great approaches to treating rosacea. Again, skincare is extremely important. So we'll be more than happy to meet and discuss all the options. Do you have any combo specials for this event? Yes, we definitely have. Just if you don't mind waiting until the end of my talk, and we'll give you all the great specials that we have. We'll text them to you. So absolutely. I think we are coming to the end of all the questions, and thank you again for being with me today. And we will send you a text. Please respond yes if you would like to hear more from us, find out which are the specials, and make an appointment for our consultations.